That's pretty cool.
Yeah, so
With the
Casey,
floppy drives.
who sang
Yep.
Tainted Love?
Soft Cell.
Good job.
Wow.
Soft Cell, and then also Marilyn Manson did a version of it, which was pretty good as well. Hey, we're hanging out here at the Intermountain
See, I knew
Sleep
he would know
Disorder
that. He
Center.
knows.
Well,
Right.
Mr. DJ.
Yes.
Yeah, and we're hanging out here and we're talking about sleep disorders. Now, the great thing about the Intermountain Sleep Disorder Center here at the LDS Hospital is that they've got a two-pronged approach, a balanced approach to solving it. We've got Dr. Farney here and we've got Lori here, and the two-pronged approach would be what, Dr. Farney?
Well, I'm pretty good at making diagnoses and prescribing pills, but I'm not very good at cognitive behavioral therapy.
And that's where Lori comes in. She's one of only two in the state that can handle that, and that helps the psychology of it, right?
Absolutely. Yeah, and the fact is that a lot of what happens with insomnia is we develop these behaviors that then interfere even more with sleep. So I address a lot of that.
It becomes a vicious cycle. Because of this, you're doing that, and if you could remedy this, you'll get a little better sleep here.
Absolutely.
All right, and so if people have questions, of course, we have the phone banks open, and you can dial it right now. The number is 1-877-908-0680. We have specialists on hand willing to take your questions and try to help you out. What are some of probably the most common questions people have when it comes to their sleeping patterns?
How much sleep do I need? Why can't I get to sleep? I snore. What can I do about that?
Well, let's tackle snoring. What is the major problem of snoring? Is it obesity? Is it a blocked air valve?
Snoring is due to the collapse of the upper airway. Obesity is a big common factor, but you don't have to be obese to have the problem.
And you guys can help with snoring?
There's all kinds of things that we can do to help with snoring. The problem is that snoring may be a sign of something much more serious, which is obstructive sleep apnea syndrome.
All right, and if people want to get more information about you, Lori, how do they do that?
They can call here, and certainly the office can talk to them about me, and they're welcome to come see one of the sleep doctors, and then they would refer them to me if they think insomnia is one of the main issues that they're dealing with.
Once again, we're live at the LDS Hospital in the Intermountain Sleep Disorder Center. We're going to send them back to you guys. Don't forget, if you have any questions, call 1-877-908-0680. They'll answer your questions. Coming up, we're going to tackle sleep apnea and show you the machines they started with and the machines they're doing now.
Yeah.
Back to you guys.
Well, I'm a snorer, and I've always been
Are you?
afraid to go to the doctor because they might say, well, we'll have to cut off your Adam's apple or something.
Oh,
That's probably